Healthcare in America and a disturbing new report, especially for mothers and children. According to the report by an international child advocacy group, the United States ranked worst for maternal health among the world's developed countries. BC Onilieri has more.
The report looked at the best and worst countries to be a mother based on 5 indicators, one of them being maternal mortality. The study is by the child advocacy group Save the Children. According to the report, women in the United States face a 1 in 1,800 risk of maternal death, the highest risk of any developed country in the world. An American woman is more than 10 times as likely to die in pregnancy or childbirth as a Polish woman. Norway is the safest for mothers. Somalia is the most dangerous. According to the group's 2015 Mothers Index rank, the United States came in 33rd. The study also looked at infant mortality rates. And in a survey of 25 of the wealthiest capital cities, Washington, D.C. had the highest mortality rate. Its infant mortality rate is 3 times higher than that of Stockholm and Tokyo. In D.C., the gap between the rich and poor makes for plenty of debate among legislators, but it is also a factor in the survival rate of its babies. In 2013, in the city's poorest neighborhood, there were 10.9 deaths per 1,000 live births, compared to 1.2 deaths in the city's richest neighborhood, making the infant mortality rate close to 10 times higher in the poorest neighborhood compared to its wealthiest community. In recent years, D.C. has cut its citywide infant mortality rate in half, but it's still higher than the national average, and the city's poorest neighborhoods continue to have the highest mortality rates. BC Onilieri, Al Jazeera, New York.
And Dr. Devi Parent is here. She's a physician and associate professor at NYU Medical Center. Welcome back, Dr. Devi. What's your reaction to this report?
I mean, I found this pretty alarming given that we are arguably the most powerful country in the world. So to be doing so poorly on these measures is really concerning.
So what does it tell us about medicine, and what does it tell us about the relationship between medicine and poverty?
Sure. Well, the relationship between poverty and medicine or health is pretty clear. I mean, if you're poorer, you're not going to have access to the same health care. If we think about globally, that could mean, housing, for example. So if you're not able to pay for good housing, then how can you keep yourself safe and clean? You might not have access to vaccinations or other prenatal care, other care to keep you in good health, and then also safe drinking water and vaccines. So, I mean, there are several things that it can affect. In this country, I mean, we have poverty, not extreme poverty like we might see globally to the same extent, but still to see that disparity between the rich and the poor, it's really very alarming.
How do you go about addressing that health issue in the United States?
Yeah, it's difficult. I mean, so with the Affordable Care Act, you would think that now that people are mandated to have health insurance, that they might have better access to health care, but that's really more about medical care. I mean, some of this is related to our general lifestyle, right? So social, economic factors, political factors. I mean, if you even think about our lifestyle, we're used to going, go, 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 and then finally addressing a problem once you have a health problem, as opposed to focusing more on preventing the problem.
So how are these other developed countries handling this issue better than the United States?
Yeah, so, well, it's hard to know. I mean, I think to be fair to the U.S., in terms of some of these measures, I mean, we have a lot more people living with chronic health conditions. So we're taking care of potentially sicker people. And when you look at the pregnancy rates and stuff, people who might not carry these babies to full term, or, people who might have had miscarriages earlier, we're seeing them actually able to give birth. And we're seeing, sicker children being born. So to be fair to us, we might be doing better in that sense. I mean, in terms of the other developed countries, I think they're probably investing more in terms of education and healthcare and preventing problems.
Yeah, it points out an important issue for the United States to deal with. Dr. Devi, it's good to see you.
Nice
Thank
to
you.
see you too.